Hey, this is Doc Yates. I'm a naturopathic doctor, registered acupuncturist, and a kinesiologist, owner of the Yates Naturopathic Clinic, and the founder of the interactive health website, Able Health. And this is the Simply Health Podcast, a show for females where I work to simplify and demystify the secrets of achieving optimal health naturally, based on my own experience in working with thousands of female patients over the past 15 years of my clinical practice. Welcome to Simply Health. Hey, this is Doc Yates, and on the drive today for the Simply Health Podcast, we are going to be talking about how to deal with breast pain. It looks like we've got 7 simple tips that you can apply to deal with breast pain. Now, typically, if you see your doctor and this is a major concern and you're having consistent breast pain, the main thing they're going to do is ultrasounds, possibly mammograms, to rule out the big C, cancer. And in this case, this is rare that I agree with them, but I 100% agree. You always want to rule out any really big things first. And of course, the vast majority of the time, fortunately, it's not that, which then leads us to, now what do we do? And that's what I want to talk about today, the now what. We've ruled out the major things, but there's still obviously an issue. Rather than say, you know what, everything's fine, because we know it's not, let's fix it. So these are the things that I have found in practice, and there's definitely some overlap in how they work to how to deal with breast pain, and in no particular order. So we're going to start off with number 1, iodine. So very commonly I do find people are deficient in iodine, and iodine, people always think about iodine in terms of the thyroid. So it's all about thyroid health, it's all about thyroid health. No, it plays a huge role in breast tissue, it plays a role in lymphatics, which also plays a big role in breast tissue, and it can play a little bit of a role in your hormone balance and ovarian function, which therefore also plays a role in breast health. So iodine needs to be considered. There's a lot of different schools of thought on iodine. There's the low iodine crowd, then there's the extreme high iodine crowd. I like to kind of fit in the middle. So I've seen people who are like, you need 100 milligrams, which is, like 100,000 times the daily dose. I usually put people on 1 milligram a day, whereas the recommended daily dose is maybe even a tenth of that. So I like to go with about 1 milligram a day, and then also on top of that, encourage iodine-rich foods. The second thing, and this is something that I learned from a patient, to be honest. They were dealing with breast pain, and we always used to use this in school for other aspects, but evening primrose oil. We've always talked about a lot from its omega aspect and its healthy fat aspect, but it plays a big role in breast pain. So if you are dealing with breast pain and we've corrected iodine, make sure that you're getting iodine-rich foods and you're still dealing with it, consider evening primrose oil, especially in cases where you're on bioidentical hormones. All the numbers seem balanced out, but for some reason you're seeing breast pain. And I haven't personally seen this in any of the cases that I prescribed it for, but this individual was her hormones were being taken care of by a different practitioner. So I can't comment on her dosing, but I would say the evening primrose oil helps quite a bit. And then I have seen it in other cases that were not on bioidentical hormones, and it helped quite a bit. So point number 2, just to summarize, evening primrose oil. And another thing that goes hand in hand with that is point number 3, vitamin E. Vitamin E can play a big role in breast pain too. Now, I know going really high dose vitamin E definitely doesn't seem to be a great idea, but generally I have people do the equivalent of about 400 IUs using like a mixed vitamin E, so they call it a mixed tocopherol. So if you wanted to add those two together, and sometimes you can find them combined into one, where it's evening primrose oil and vitamin E in a combination. So I guess if you got that, put a few drops of iodine into it, so it was all built into one, it wouldn't taste very good, but it would definitely be a simple way to do it. Number 4, especially if I'm seeing other symptoms that attribute to this, we've talked about in previous podcasts what's called qi stagnation. In Chinese medicine, it's when you get this enough stress built up and it leads to this stagnation of qi, which generally people think of, and I've described to people, more frustrated, more irritable. If you're seeing that, and you're seeing it along with chest pain and like distension, like a fullness feeling, and you haven't actually done anything, like, and all the hormones are balanced, consider working with qi stagnation. The best way to do that, I've mentioned these herbs before, but because it's such a classic and great formula I found for female concerns, You always use peony, bupleurum, donquay, and then I'll put the iodine built into that. So that formula, and then I'll usually add one or two other herbs to it, depending on what else other concerns are there. But that works great. And I know probably most of those herbs you might not have heard of, but it is a very good thing to consider. So if you are dealing with frustration, irritability, and getting breast pain at the same time, and you've dealt with the other aspects, consider looking to this chi stagnation or finding someone who can help you with that. Number 5, the lymph. We talked about the iodine, how iodine plays a role in lymph health, and I'm sure you've heard a lot of times, like, you got to, if you're getting a lot of breast pain, it's the bras, the wire bras, everything that's cutting off the lymph circulation. That can play a big role. So changing your bras, doing more what they call lymph drainage massage, and it's basically massaging from the breast towards the armpit to encourage the drainage of the lymphatics. And you can combine that with, there's specific oils they call lymph oils that can help. Now, if you can't find a lymph oil, the base of pretty much every lymph oil is castor oil, which is a great anti-inflammatory and helps drain the lymph. And then to make it a lymph oil, there's other herbs infused into it, like phytolacca or viola. So if you can't specifically find a breast oil, then get some castor oil, use that to massage the breast and towards the armpit to get the lymphatics to drain. And this is something that is done like classically in naturopathic medicine, not just for breast pain, but even for like breast cancer cases. So definitely you want to consider doing that, especially if you're not seeing the results. So again, in no particular order, but dealing with lymphatics is a very important role for breast health. Number 6, acupuncture plays a role. It can help with lymphatics, the circulation, chi stagnation, all of the above. And of course, the nice thing about acupuncture, you don't have to worry about it interacting with any of the medications that you're on. So acupuncture can play a role. And of course, number 7, hormone balance. Hormone balance plays a role in everything, especially for female health related, at least in terms of like female hormone imbalance, like breast pain, fertility, perimenopause, and in this case, you're going to see issues with, if it's perimenopause, chances are progesterone's dropping, estrogen's too high, leading to this imbalance, just like all the cases we've talked about in previous podcasts. So whether you're using, now if you're already on bioidentical hormones, it means you probably need to get retested and adjust your dose, especially in perimenopause, because the thing is with perimenopause, when you're treating hormones, is that your body is in a transition state. So let's say you were bringing up your progesterone levels a little bit with some progesterone cream, but your actual natural progesterone levels are still in a free fall because that's part of the process of perimenopause. That means that you sometimes need to take a little bit more to compensate for that. So retest when needed if you're getting these symptoms, and then reestablish your hormone balance. If you're not in perimenopause, for instance, say your daughter, who's 18, 25, is struggling with severe breast pain, in those cases, using supplements like things with DIM in it makes a big difference. So if you could get just some DIM and then make a formula, or use a formula, like I use a formula where it's DIM and Vitex combined, because Vitex helps a lot with progesterone for females, especially when it's not that they're deficient, it's just that they're not utilizing it properly. DIM and progesterone, and it clears it up pretty quick. Typically within 2 cycles. So threw a lot of information at you there today with regards to breast pain. The point is, there is a lot you can do. You do not have to suffer through this. You've ruled out the big C. Don't have to deal with this for the rest of your life. So let's get to the root of it and address these things. So I hope this was helpful. Again, I really encourage you to subscribe and to share this information with other people, because chances are there's a lot of people who aren't talking to you about their breast pain, but they're probably dealing with it. So if you can help them by sharing, that's great too. So this is Doc Yates, signing off. Thanks for tuning in to Simply Health. If you want to learn more about health, check out Able Health. If you want to see some of the other projects that I've been working on in health, business, music, and life, please check out the links below.